Hello and welcome again to Allied Health Educare. Allied Health Educare is the one of the fastest growing online MLT coaching center based in West Bengal. AG is now providing you some lecture regarding various interesting topic that is very useful for your daily lab work, and as well as it enable you also to interpret very effectively any result. As you all know that accuracy and the precision are the prime features of a good quality clinical laboratory. So it is the goal of Allied Health Educare to teach you in effective way so that you can interpret any result very effectively. So our today lecture is about RDW. Have you ever wondered what it actually is? Have you ever thought deeply what is it? If you see any PBS or peripheral blood smear, you can find the millions of RBC, but all RBC are not same in size. Today I will discuss about RDW. RDW stands for red cell distribution width. So what is RDW? Every day we have to run many CBC samples. There are lots of parameters. These parameters, some parameters are consist of cell, that is RBC, WBC, platelet, and some parameter consists of differential count. Some parameter consists of platelet count, and lastly, there are some special parameter that is called RBC indices. And in the RBC indices, there are MCV, MCH, MCHC, and there are also two parameters, that is RDW, SD, and RDW CV. So what is RDW? What is SD? What is CV? This is the discussion topic of today. So here we can see there are two CBC report. The first CBC report denoting the RDW CV percentage is as 34.7%, and in the second report here the RDW CV percentage is 12.9. What does it mean? Why in case of CBC report 2 the RDW value is 12.9%, and in CBC report 1 here RDW value is 35%. Why this difference occurs? So let's have some picture. Before going to RDW, I am showing you a normal peripheral blood smear. This is the normal peripheral blood smear. All are okay. Here you can see that you can see millions of RBC. You may see millions of RBC, WBC. So in case if you consider the RBC and if you consider the sizes of RBC, you may find little variation in the sizes of RBC. Little variation, not too much variation in the RBC sizes. This variation in sizes of RBC is called anisocytosis. What is anisocytosis? Anisocytosis means variation in sizes of RBC. That means if there are too many variation or there are larger variation, the degree of anisocytosis will be higher. And if there are little variation between the sizes of RBC, then it means there is a small degree of anisocytosis. So here you can see that most of the RBC having same set, there is a little variation. So in normal sample or in a normal peripheral blood smear, there is a little variation in sizes of RBC. This degree of variation in sizes of RBC is called anisocytosis, and this anisocytosis is expressed by RDW CV percentage. Now move to the second slide. So what I have said earlier, there is a little variation. This is the case number 1, and this is the case number 2. Here you can see that there in case number 1, there is a little variation of RBC. This is RBC. These all are RBC. The rounded shape are RBC. There is a little variation. There may be variation. This variation may be very, very little. But in case of case 2, you may see that here the variation is much more larger. Now, I am showing you another 2 peripheral blood smear picture. In PBS2, let's look at the PBS2. Here you can see that there is a variation of RBC sizes. Variation in RBC sizes. There are different type of RBCs there. And one thing must be noted. If the variation, if there is a variation in the shape of RBC, that is called poikilocytosis. What is poikilocytosis? Poikilocytosis refers to the variation in shape of RBC, not size. If it is size, then it is termed as anisocytosis. And if there is a variation in shape of RBC, then it is called poikilocytosis. And if the anisocytosis and poikilocytosis coexist, or if the 2 condition is found simultaneously, then the total condition is called anisopoikilocytosis. So here you can see the case number 2. Some RBC are normal in shape. Some RBC are normal in shape. This is normal. Some RBC are smaller in shape, and some RBC are larger in shape. So there is a variation in sizes. And I'm pointing it out with different color. And if we see this type of cell, this is teardrop cell. This is just like elliptocyte. If you see this type of picture, this type of shape, you can easily understand what poikilocytosis is. Poikilocytosis means variation in shapes. So RDW is a parameter by which we can easily or very effectively we can measure this type of situation: anisocytosis, poikilocytosis, or anisopoikilocytosis. But more effectively, we can determine the anisocytosis. So in this 2 picture, in case of PBS2, peripheral blood smear 2, you can see there is a degree of anisocytosis. There is a larger degree of anisocytosis. So in this PBS, there is a RDW 18%. 18%. 18% is what is the normal range of PBS? RDW. Normal range of RDW lies between normal range of RDW is lies between 11% to 14%. If the RDW value goes beyond the 14%, then it is called abnormal. So here in the PBS2, the RDW value is 18%. You can see very easily, and you can also verify this RDW value from the PBS. And in case of PBS3, you can easily understand the variation is much more greater as compared to in comparison to it peripheral blood smear 2. So here is a RDW that is 24%. So degree of anisocytosis is much more greater than the PBS2. PBS2, in case of PBS2, there is a RDW of 18%, and in PBS3, the RDW value is 24%. Now the question is how to measure the red cell distribution width. Remember one thing, we cannot measure RDW manually. By manual method, it is impossible. It is impossible, not nearly to impossible, it is totally impossible to measure the RDW value. The RDW value should be measured, or it must be measured automatically by the use of cell counter. We know all the what is cell counter because it is the every day we have to deal with cell counter. So first of all, we must know how a cell counter works. Then we go to our exactly topic, what is RDW. So machine employs a special principle that is called Coulter principle, or it is also called impedance method. The impedance method is a method by which an instrument can measure the count of different type of cells, WBC, RBC, and platelet. This is called impedance method. So what happened in impedance method? Impedance technique deals with the electrical field. What happened in a 5-part or 3-part machine? There are numerous counting chamber. First, once the blood is aspirated in the machine mixes the blood with diluent. This diluent content a conductive liquid. Actually, this diluent is nothing but conductive liquid. This is the conductive liquid. So once you have just aspirated the sample in the machine mixes the irritated blood with the conductive liquid and introduce the blood mixed with conductive liquid into a counting chamber. Let's suppose this is the counting chamber. This is the counting chamber. In the counting chamber, there are two electrolytes, one is positive and one is negative, and there is an elliptical field. And what happened? There is a small aperture. There is a small aperture between positive electrode and negative electrode. Now what happened? Machine forces the cell to pass through the small aperture. So what happened? As the cell are non-conductive to electricity, what happened? The cell, all cell, WBC, RBC, platelet, all are non-conductive to electricity. When the cell passes through the small aperture, what happened? A resistance generated. A resistance is generated, and this resistance is the key features of impedance method. The system that is provided in the machine, what they do? They convert the resistance into a pulse, and this is the pulse. So what machine do? They convert the resistance into a pulse, and every cell passes through the small aperture, a pulse is generated. So each pulse represent one cell count. So there are, I am showing you three types of cell. The red one is RBC, green one is WBC, and the violet one is platelet. As the WBC being larger as compared to RBC and platelet, the height of pulse is much more broader. The bigger the size is the bigger the size of the WBC, the broader the pulse or bigger the pulse. Platelet being the smallest cell among the three types of cell, so it creates a smallest pulse. The pulse generated by RBC, it is the moderate or medium pulse, and the pulse that is much more greater than RBC pulse or platelet pulse is considered to be a pulse generated by WBC. So as the cell passes through it may be WBC, it may be platelet, it may be RBC. As the cell passes through the aperture, a resistance occur or resistance is created, and this resistance is the key features of impedance method, and it is converted to the pulse, and machine count the pulse in a certain time, in a given time machine count the pulse, how many pulse. If as per example, I'm saying that in a given time 5,000 pulse is generated. 5,000 pulse is generated means in a given volume of the sample, or in a given volume of the sample, 5,000 cells are present. According to the size of pulse, machine determine whether it is WBC, whether it is RBC, and whether it is platelet. Now move to the next slide. What I have said, it is written here. What is the Coulter principle? Coulter principle or impedance method is same. The Beckman Coulter has introduced the Coulter principle, or it is also called impedance method. So look at this picture. in this picture, you can see that the cell is passing through the aperture, and at that time a pulse is being generated. A pulse is being generated. You can see from the picture, the cell get closer to the aperture, the pulse is being formed, this pulse is being formed, and the cell go further from the aperture, the pulse ends at the baseline. So the cell get closer to the aperture, the pulse is being formed, and as the cell moves here, as the cell moves here, the peak of the pulse is generated. The peak of pulse is generated, and as it go beyond or go further from the aperture, the pulse touches the baseline. So this is the principle how impedance method is work and how pulse is generated. Now you can see the more prominent what actually happened. What I have said. The cell. This is the cell. The red cell is moving towards the aperture. As the cell get closer to the aperture, so the pulse is being formed, and it moves further from the aperture. The pulse is end. Now how machine calculate hematocrit or PCV and MCV? This is the key point. You have to understand how a instrument calculate hematocrit and MCV before proceeding to RDW calculation. So in conventional method, we use introbe tube. We use introbe tube and put blood into the introbe tube, and the introbe tube is centrifuged at 3000 rpm for 20 to 25 minutes. After that, the packed cell RBC is counted, is calculated. How much percentage RBC packed cell is there? So this is how normally, manually, in conventional method, hematocrit is calculated. But how a machine or how a 5-part or 3-part cell counter can calculate a hematocrit hematocrit or PCV? There is no system of centrifugation in cell counter. So the machine uses the pulse generated by the impedance technique. Machine utilizes the pulse that is generated by impedance method during the cell count to calculate the PCV. There is a complicated formula by which machine can calculate the hematocrit. I am not going into too much details. Here what happened? This is pulse that is generated by resistant. The resistant is being converted to pulse by the system. And this PCV or hematocrit is calculated from the cumulative pulse height method. Machine measures actually the pulse height. This is pulse height. This is the height of the pulse. This is height of the pulse. So machine, what machine do? They accumulate all the height of the pulse and they put it together and calculate the hematocrit. And machine obviously uses this formula. I am not going into details in this formula because it is very difficult to understand. And that is how hematocrit is being formed. And how MCV is formed? We know the MCV formula. MCV equals to hematocrit into 10 divided by RBC count. So as the machine calculated the hematocrit, so machine got the hematocrit value. It multiplied the hematocrit value with 10, and then the value is divided by total RBC count. Then we can get the hematocrit value or PCV value. So this is how a machine can calculate the hematocrit or PCV value by using this type of technique that is called pulse height technique. You should remember the pulse height technique. Now, coming to the next point, main point. This is the main point, how RDW is calculated. So you may be or not maybe may not be familiar with this normal distribution curve. This is the normal distribution curve, or it is also called Gaussian curve. When you prepare LJ graph for the purpose of quality control, internal quality control, you have to rely on this type of normal distribution curve. Actually, normal distribution curve is represented by LJ graph. LJ curve represent or LJ graph represent actually the normal distribution curve. This is the normal distribution curve. So what happened in normal distribution curve? Let's assume machine calculated 1000 cells. Machine calculated 1000 cell or counted 1000 cell, and machine calculate the MCV. What is MCV? MCV means mean corpuscular volume. So here is a Gaussian curve. In case of Gaussian curve, there are many things. There is a mean. The line from the peak of the curve to the base of the curve is called mean. This is the mean line. This is the plus 1 SD in the right side of the mean. This is plus 2 SD and this is minus 3 SD. Whereas at the left side, it is minus 1 SD, minus 2 SD, and lastly it is minus 3 SD. And here, suppose the machine calculated the mean as 100 femtoliter. Let's assume the mean is 100 femtoliter. Here mean represent the MCV. Here mean represent the MCV. Now machine calculated 1000 cell or counted 1000 cell. So in 1000 cell, 68.26% cells lies between plus 1 SD to minus 1 SD. This is the rule. This is the rule of Gaussian curve or normal distribution curve. If a machine counted 1000 cell, machine from the 1000 cell machine calculated the MCV value, and we can see 683 cell lies between the MCV, the volume of the 383 cells lies between the range of 90 to 110 femtoliter. As you can see from the Gaussian curve, 90 to 110 femtoliter. Out of 1000 cell, 955 cells volume lies in between 80 femtoliter to 120 femtoliter. 95% 44 cell, 95% 44 cell or 955. I am rounding of the all value. 955 cell lies in between 80 to 120 femtoliter, and 997, that means 99.7% cell lies in between 70 femtoliter to 130 femtoliter. So in Gaussian curve, we can see from the picture there are two axes. This is called y-axis and the base is called x-axis. X-axis represent the plus SD, 1 SD, mean, etc. And the y-axis, now the main features, the main funda of the lecture or calculation of RDW is y-axis. This y-axis, the peak of the from this line, you have to consider this line. This line touching the peak of the curve is represented by 100%. This line, I am talking about this line. So this line touching the peak of the curve is 100%. And let's suppose this is the another line. Just let me change the color. Let me change the color. Let me change the color. Okay. And let's suppose this is the the green line represented represent 20%. Actually, what happened if you consider from here to here 100%, then this portion is called 20%. So this 20% value, this 20% value represent the red shell distribution width. What happened? The 20% value, that is 20% value represent the actual RDW value. Now move to the next slide. You will understand much better. This is the calculation. So what happened? There are two parameters. If you look very carefully to your CBC report, there are two parameters. One is RDW standard deviation SD, and another one is RDW CV percentage. Two value represent the variation. If you know the quality control very well, then you can understand it very well. The standard deviation means the variation between the values, and CV percentage is the percentage of standard deviation in terms of mean. So one is RDW-SD and one is RDW-CV percentage. We have to consider only CV percentage, not the SD value. Just look at the picture. There are two values. One is RDW-CV percentage and another one is RDW-SD. We need not consider the RDW standard deviation value. We have to consider the CV value. So greater the CV value, greater the degree of anisocytosis. Greater the CV percentage value, CV percentage represent the variation between the values. So CV percentage is bigger, then we can understand the degree of anisocytosis is also greater. The CV is low, the degree of anisocytosis is also low. So there is a proportional relation between the anisocytosis and CV percentage. Variation, if variation is low, variation is high, then CV percentage is obviously high. If variation is low, then the CV percentage is obviously low. So here, from the normal distribution curve, this represents the normal distribution curve. What I have shown you earlier, this is the normal distribution curve, and this is the also normal distribution curve. So 20%. What I have said, the 20% of the this value represent the RDW. This is the RDW. This value represent the RDW. This is the calculation of RDW standard deviation. So we need not to consider about this RDW SD value because we have to consider only RDW CV percentage. So now look at the second picture, how to calculate RDW CV percentage. The formula of RDW CV percentage, as I have told you earlier, the CV percentage represent the percentage of standard deviation in terms of mean. So CV percentage, RDW CV percentage calculation is 1 SD. 1 SD means, what do you mean by 1 SD? 1 SD means, in case of this picture, 1 SD means this portion. Let me show you. 1 SD means this portion. This portion is called 1 SD. This portion is called 1 SD. So I am just showing you what is the portion of 1 SD. So the actual calculation is, the calculation of RDW CV percentage is 1 SD value, 1 SD value divided by mean. Here mean is MCV. This is the MCV into 100%. as the semi percentage value is represented by in terms of percentage. So here from this formula, the machine calculates the RDW semi percentage. We need not to calculate it manually because it is very lengthy and laborious and very time consuming and near to impossible to calculate manually the RDW CV percentage or SD value. So let it do for the machine. We need not to worry about it, how to calculate. I am just showing you the fundamentals, how machine calculate this RDW CV percentage value. And I have given you little idea about the RDW calculation and when the RDW value is considered. The importance of RDW value is to diagnose different type of anemia. As I have already told in my previous lecture, part 1 lecture, in case of iron deficiency anemia, there is an increased value of RDW CV percentage. And this RDW CV percentage value in case of iron deficiency anemia, it goes beyond the 14%. Sometimes in case of thalassemia, it also become very high and goes beyond 14%. So this is the use of RDW CV percentage value. So in case of diagnosis of different type of anemia and different type of condition and a different type of situation, so we have to use the RDW CV percentage. And sometimes in case of very research purpose, we may use the RDW value. So today's lecture, I am concluding the today's lecture, and today's lecture I have taught you how to calculate the RDW value, what is anisocytosis and what is poikilocytosis, and how a machine measures the RDW value. So stay tuned to our channel. Please share, subscribe and comment, and don't forget to support us. Thank you.